The pandemic didn't just upend where we see our doctors, it redrew the very map of the healthcare workforce. What began as a scramble to keep patients safe has matured into a resilient, tech-driven ecosystem worth more than $55 billion in telehealth revenue alone by the end of 2025. Add remote monitoring gadgets, cloud billing platforms, and decentralized clinical trials, and the wider remote healthcare market is sprinting toward $13 billion this year with double-digit growth locked in for the next decade. For job seekers, the numbers translate into real, stay-at-home paychecks. In early 2023, only 1 in 10 new postings was fully remote. By early 2025, that share had climbed to 13%, and healthcare sits proudly in the top 3 most remote-friendly industries. So whether you thrive on patient triage, enjoy decoding medical data, or dream of steering health tech strategy, you can now build a career from a HIPAA-compliant corner of your living room, and often earn just as much as your on-site peers, minus the commute and the burnt coffee in the staff lounge. Let's tour the 10 best-paying roles you can land right now, why they work so well off-site, and how each one can grow into a long-term career. 1. Remote Registered Nurse, RN. Picture the classic bedside RN, but swap the hallway call bells for a high-def video console. Using integrated telehealth platforms, remote RNs perform head-to-toe assessments, adjust care plans in real time, and coach chronic disease patients from hundreds of miles away. A compact state license and a couple of years in acute care unlock salaries north of $90,000, with pathways into team leadership, virtual care program management, and even stock option packages at fast-growing health tech firms. Predictable shifts and a nationwide patient panel? Not a bad trade for leaving behind those 12-hour marathons on the floor. 2. Remote Nursing Assistant, CNA. You might think certified nursing assistants need to be physically present, but most of their core duties, monitoring vitals, recording activities of daily living, offering emotional support, are observational. Armed with tablet-based kits, remote CNAs check on patients, verify medication adherence, and loop in supervising nurses at the first sign of trouble. Pay lands around $18 an hour, and many employers offer tuition reimbursement so CNAs can bridge into LPN or RN programs. Flexible, bite-size shifts also make this role a perfect fit for students and family caregivers. 3. Remote Medical Coder. If you love puzzles and precision, coding might be your jam. Coders translate every diagnosis, procedure, and test into the ICD-10, CAPTAIN, and HCPCS codes that keep revenue flowing. Because it's 100% data-centric, the job moves online effortlessly. Dual monitors, a secure VPN, and an AI-assisted encoder are your new tools of the trade. Typical wages fall between $38,000 and $50,000, but specialty credentials can push earnings to $70,000 and open doors to auditing or compliance management. Heads-down work, flexible hours, and freelance contracts sweeten the deal. 4. Virtual Medical Assistant. Doctors still need someone to room patients, prep charts, and chase down prior authorizations, just not necessarily in the same building. Encrypted VoIP lines, e-prescribing portals, and cloud EHRs let virtual MOS eliminate waiting room bottlenecks from afar. At roughly $50,000 a year, seasoned assistants often pivot into practice operations analysis or health coaching, collecting extra certifications along the way. All the satisfaction of keeping a clinic humming, none of the clinic traffic. 5. Remote Nurse, Utilization-Review. Insurance carriers and accountable care organizations lean on RNs to decide whether treatments are medically necessary and cost-effective. Digital chart review tools, machine learning flags, and screen sharing with physicians replace in-person rounds. Expect earnings around $88,000, with the chance to break 6 figures by adding case management credentials or moving into clinical quality director roles. Oh, and your schedule is Monday through Friday, holidays off at last. 6. Remote Clinical Research Coordinator. Clinical trials are going hybrid. Wearables capture vitals, courier kits collect lab samples, and participants sign e-consents from home. That makes CRCs the conductors of a global orchestra, ensuring protocol compliance and data integrity via dashboards instead of boarding passes. Hourly rates hover near $40, and extra certifications can propel you to clinical research associate or even operations director. Positions that flirt with six-figure salaries while keeping your passport safely tucked away. 7. Telehealth Nurse. Separate from the generalist RN, telehealth nurses specialize in virtual triage and chronic disease coaching. They juggle video calls, secure chats, and live dashboards streaming blood glucose or blood pressure readings. Pay starts in the low 60s and climbs toward $90,000 as you add experience, with potential leaps into product training or program director roles, and equity at digital health startups. Serve patients nationwide from any time zone with solid Wi-Fi, yes, even from that cabin in the mountains. 8. Health Information Technician. If safeguarding data sparks your interest, HIT positions let you maintain electronic health records, run HIPAA compliance audits, and generate quality improvement reports, all through a secure VPN. Entry-level wages sit around $38,000, but layering on data analytics skills or privacy officer credentials can double that figure and land you a seat at the strategy table of AI-driven hospital initiatives. Introverts, rejoice. It's quiet, focused, and fax machines are finally extinct. 9. Remote Pharmacy Technician. Mail-order pharmacies and pharmacy benefit managers process mountains of prescriptions every hour. Remote techs verify orders, navigate insurance hurdles, and tutor patients on mail-order refills, all without the retail counter hustle. At roughly $40,000 a year, seasoned techs can rise to telepharmacy supervisor or operations analyst, or even use employer tuition aid to pursue a farm. Expect evening and weekend shifts, ideal for night owls juggling other commitments. 10. Remote Medical Director. At the top of the ladder sits the medical director, providing strategic clinical oversight for telehealth startups and national payers. Virtual dashboards deliver real-time metrics. VR boardrooms replace coast-to-coast flights. Base pay averages $245,000, and equity or performance bonuses can catapult total compensation past $400K. From there, paths lead to chief medical officer titles or even founding your own digital health venture, proof that board-level influence no longer requires a corner office. The road ahead. Taken together, these roles paint a future where healthcare talent is distributed, digital, and deeply human. Patients gain access, providers cut overhead, and you reclaim the hours once lost to traffic and fluorescent hallways. If any of these careers sparked your imagination, head to Higher Basis, your launchpad for remote healthcare careers of every stripe. From entry-level gigs to executive leadership, the listings are live, the demand is real, and the next step is yours to take. So stay curious, stay certified, and I'll see you on the remote side of healthcare.